Welcome to Coding Dojo. Today we will talk about tips for coding and documenting non-pressure chronic ulcer of skin. Ulcer of skin can result when an underlying disease interferes with the normal healing processes of a lesion or wound. Chronic ulcers of skin are of three types: arterial ulcer, venous ulcer, and neuropathic ulcer. Effective treatment of chronic ulcer of skin is dependent on identifying the type of ulcer and underlying disease or diseases. Here are some tips to code non-pressure chronic ulcer of skin. 1. It is advised to code first any associated underlying conditions, such as E11.621 DM with foot ulcer, E11.622 DM with other skin ulcer, I70.23 atherosclerosis extremities with ulceration right. 2. Code first any associated gangrene, I96. 3. Documentation must specify an ulcer or ulceration is present, the site, laterality, severity, and be linked to the underlying disease or diseases if known. For example, diabetic ulcer of plantar surface, left foot, should be coded as E11.621 DM2 foot ulcer, L97.429 non-pressure chronic ulcer of heel and midfoot, unspecified severity, left. Here are some documentation tips. Call an ulcer an ulcer. Do not document it as a lesion or wound. Don't forget to document the location, laterality, severity, and the plan for the ulcer and any underlying disease. While severity is now included in the ulcer codes, staging is only required for pressure ulcers. Example: left heel ulcer with necrosis of muscle should be coded as L97.423, where L97.4 represents site, 2 represents laterality, and 3 represents severity. If due to DM, one should also code E11.621 type 2 DM with foot ulcer. Be sure to resolve once the ulcer has healed. So that was all about how to code and document non-pressure ulcer of skin. Next time, we will be back with more insightful coding and documenting tips.